Yeah, so I'm Izzy. That's a nickname that I go by. And I have a lot of lived experience in the mental health system, and mental health challenges, struggles, however people feel comfortable wording it, for decades. I'm in my 40s and it started when I was a young teen. And I'm very passionate about sharing my experience in the hopes of, making people better able to make the right choices for themselves. I'm not interested in imposing my ideas upon other people, but just sharing. I like to support and help and guide anyone who wants it. Up in Belgium, and my first hospital experiences and mental health experiences that were non-hospital were in Belgium. And I was kind of used to how that worked, which was very non-invasive. It was kind of gentle, like, well, if you want to go into treatment, you can. Even, as a teenager, my first suicide attempt, I was actually 12, but it was serious when I was 15, and it was sort of like, well, you should go see this therapist. And I'm like, I don't want to. But they said I had to, but they weren't going to watch me go there. They didn't, they wanted to hospitalize me, but my mom said no. And they're like, okay, but it wasn't like forceful at all. And I did go see this therapist who I never spoke to. He asked me questions and I didn't say anything. I'm like, I'm just here because I was told to come here. So, but there was nothing like forceful about it. Okay. And I was not told to take any medications or anything like that. So that's sort of what I was used to. And I was also at some point in a hospital for eating disorders. But it wasn't entirely voluntary, but it was open. I could leave. I was strongly urged to go and to stay, but it wasn't locked. And the grounds are beautiful. And this, Belgium has a centralized healthcare system, so you can be in a really nice hospital. It doesn't cost you anything. There's tennis courts and volleyball courts and a swimming pool. And this is just a regular hospital for like eating disorders for teens. It's not for like rich people or anything. So the experience was really unpleasant because, well, I didn't like being in treatment, but other than that, it was okay. Especially then when I came here in '96, it was completely different. I was really shocked. I didn't get into the mental health system here until like '98 when my grandmother died, who I had been taking care of. She actually was my dad's mom, and they're American. Well, she was Polish, but anyway, here. And I was taking care of her, and she died on Christmas, and like a few months later. I had a full-time job, and I lived with my partner, and everything was pretty normal, but I started feeling like I was slipping a little. I was like, I'm slipping back into old habits and it's not good, and I wanted to be preventative. So I was like, well, where do I go for treatment? I didn't actually have like insurance that covered, mental health treatment. It covered other things. So I found a mental health clinic here in San Francisco, which is like one of the county mental health clinics. They said, well, you can come in and do an intake and an assessment. And I was like, okay, I'm just looking for a therapist. I just need to talk some things through because I don't want to like go way downhill like I have in the past. And I kind of know my patterns a little bit. Well, I did at the time. Now I'm just lost. So I went and I had this intake interview, and they asked me many questions, and it all seemed fairly normal. And one of the questions was, do you harm yourself? And back then, I hadn't for years, but I was starting to, and that's one of the things I was worrying about. But it was superficial. And I told them that. I'm like, yeah, that's part of the problem. Like, I feel like I need therapy because I don't want this to get worse. And but it's really superficial right now, and I'm taking care of it, and wanting to work on it. And And then they left the room. Well, the intake person left the room. Because I wait here, and I'm waiting and waiting. It was very weird. I was like, I don't know what's going on. And then anyway, he comes back, opens the door, and there's 2 police officers standing next to him. And I was really confused. I was like, hi? And he said, you have to go with these officers. And I'm like, what? Well, what did I do? And he said, yeah, it's for your own safety. And I'm like, who's threatening me? I was like really, really confused. And I said, I'd rather not if I have a choice. And they no, you don't have a choice. And I'm like, well, where are we going? I'm going to jail? I mean, like, he said, no, you're going to the hospital. And I'm like, but I'm not sick and I have to go to work. And he said, well, it's not a choice. And I got up and I was handcuffed. And I'd never been handcuffed before. I mean, as a teen in Belgium, I'd been, detained a couple times because, well, I was a delinquent. But never treated like that. And I was like, what is going on? I'm getting handcuffed behind my back. I'm like, I don't understand any of this. And I just kept asking, can you please explain what's going on? I don't get this at all. And they said, look, if you feel really uncomfortable going with the police in the police car, we have another car. It's just like white, city car, county car, that has like the fence as well in the back. And I'm like, I'll go in that white car then. And they uncuffed me and they put me in that white car. I was like, this is very weird. But they start driving and I'm like, where am I going? It's like going to General Hospital. I'm like, I don't like that hospital. That's really nasty. And I'm like, okay, I don't know what's going on. And I'm told to get out of the car. And I start getting led through the hallways. And I end up standing in front of these doors. And this person who drove me there says, wait here. There's like a little window through this one door and I can see another set of doors and another little window, and through that I can see like somebody's screaming and other people are just like arguing, and I'm like, what on earth is this? And I'm like, I just got a panic attack. I'm like, I can't go in there. So I just ran. I tried to run away and I got out the door. I was outside in the parking lot and security officers and stuff caught me and dragged me to what I later came to know very well, which was PS, the Psychiatric Emergency Services. I had all my clothes taken off of me. I was too terrified to do anything. I'm not normally paranoid, but I thought, my God, I've just been kidnapped and I'm in a like government facility and they're gonna do experiments on me or something, and I'm like, because this doesn't make any reasonable sense to me at all. And I was so scared that they told me to take my clothes off and to change into hospital gowns. I couldn't do it. I was just standing there. They were just taking my clothes off and they put a hospital gown on me, and this was in a seclusion room, which was horrible too. It smelled like vomit, urine. Yeah, it was disgusting. There was this bed bolted to the floor, and I was like wanting to get out when they left. And they said, no, you stay in here. And I'm like, what? No. And I'm kind of claustrophobic. And I walked out anyway. And they said, no, you have to stay in there. And they locked the door because I guess they assumed we can't trust her to stay in there. And of course, that made me even more afraid. So I started screaming and I started banging on the door. And then they came in, on force. Like 6 or 7 people came in, pushed me onto the bed, put my wrists and my ankles into the old leather restraints that they still had back then, and they were just touching me, holding me down. I had PTSD, so that didn't go over very well. I started screaming even more and biting, and and then they come with a big injection, and I've never taken a psych drug, other than in Belgium for a very brief period I took Prozac for like 3 months. But I didn't know what that was, and I get like 2 injections, and I just felt so drugged. I was like, I don't know, what are they doing? Of course, then I got paranoid. And I don't really know what happened then, except that I didn't come out of the hospital until like a month later, and I tried to go back to work, and well, my brain wasn't really functioning very well after that month because I was told I was schizophrenic, then I was told that I had bipolar disorder, and they were drugging me multiple times a day, putting me in restraints multiple times a day because I didn't want to take the drugs, so that meant they were chasing me and tying me down and injecting me every day for like a month. And it was a nightmare. And so when I got out, I tried to go back to my relationship and my job and life, and well, I couldn't really function anymore. It was, and after that, the hospital became a revolving door. And I've been hospitalized, I don't know, something around 150 times since 1998, since that first time. And yeah, it was pretty horrible. I just couldn't wrap my head around what happened. I tried to find out later. I still didn't get any clear answers. The records don't say much. They don't really explain why all that happened. And I only have like fragmented memories. But that was my first encounter, which basically kind of, I think, led to a really big decline for me because I couldn't keep my job because I kept getting hospitalized. And so then I didn't have a job, then I was put on like state disability, and I lost my insurance, and then I had to get all my care at General Hospital, and every time I went to that place I got a panic attack. Even if it was just for something routine medical. And yeah, and then I lost my partner because I couldn't deal with it, and I lost my home, and I didn't have a home anymore. And then I was just like couch surfing, people I knew, some friends of friends, my sisters, but I figured out I couldn't trust her because she kept calling the police on me anytime I disagreed with her and would say that I was suicidal just to get them to take me away. So I was like, running out of options. And then eventually I was put on SSDI, and I mostly lived in halfway houses. I was either in a hospital or a halfway house, and at some point I was also in residential treatment in Marin County for 13 months, where I kept running away. I mean, it was residential and not locked, but if I left, then they would send the police after me. And one time I tried a little too hard to get away from the police, and I ended up in jail for a night. And they took all my clothes off there too and gave me this like paper jumpsuit, and it was freezing in there. There's no blankets, no sheets, no pillows. It's the hole. I was like, well, now I know why they call it a hole. There's a hole in the ground for, doing your business. And I was kind of like so often completely baffled by my experiences that I often would laugh the whole time, which made them think I was even nuttier because you're being arrested and you're being put in jail and you're laughing. We're taking your mugshot and you're laughing. We're taking your fingerprints, you're laughing. And I'm like, because this is ridiculous. I mean, I don't know, like it must be a joke. And then I was in that jail and with no heat and no actual clothes, and I had to be rushed to the ER the next morning with severe hypothermia. The case got thrown out. I had to go to court, and the judge actually mocked the sheriff's department and told them that, if they're lucky, I won't sue them. She encouraged me to sue them. I was like, I'm too tired. Because they had absolutely no grounds to arrest me. I mean, they were supposed to put me in the hospital, not in jail. And so, a lot of things just kept happening, and I was like, what am I doing to make all this stuff happen? I mean, I must be participating in this somehow, but I couldn't figure it out. I knew that I wasn't making a lot of sense anymore because the world didn't make sense. All these things didn't make sense, so I didn't really know what made sense anymore, and things just kept getting worse. And so that's sort of how it all started. And at some point I moved back to Belgium and ended up in some more hospitals there, and then came back here and was homeless again for a little bit, but I always had some people who let me stay at their place. And then I made this friend from New Zealand, and we got a little drunk, which I didn't usually do because I didn't really eat, so drinking and not eating didn't work very well for me. I would usually just pass out then, but I ended up getting pregnant. And now I have an amazing 13-year-old daughter. But yeah, that had its own whole set of challenges. Mostly in the beginning, the worst challenges were that the medical establishment, doctors and stuff, were trying to, at first they didn't believe me I was pregnant because it wasn't showing up in urine tests and blood tests, but I don't know why I knew, but I knew. And I'd never been pregnant before, but I just knew. And I had a lot of pain, which wasn't normal, but I was worried about that because I'm like, I'm pregnant and I have pain. And they're like, okay, you're really paranoid, you're psychotic, so you're not pregnant. But after 5 weeks of pregnancy, their test finally showed that I was 5 weeks pregnant. So the whole time I said I was pregnant, I actually was pregnant. They just didn't believe me, and they put me in psych wards because I was rambling on delusional things about being pregnant. And they then accepted that I was pregnant, and then they tried to do everything to get me to have an abortion. They, at some point, didn't say an abortion, they said an ablation. Come in tomorrow for an ablation. I didn't know what an ablation was. I mean, I knew what an abortion was, but my English wasn't as good as it is now then either. I mean, I speak a lot of languages, but English is not my first or second. And I was like, what's an ablation? But I always look everything up. So I looked at it, I'm like, what's an abortion? And I'm like, I don't want an abortion. And they're like, yeah, but you should have an abortion because it's probably an ectopic pregnancy. And I'm like, that doesn't make sense. You can clearly see it in my uterus and not, my fallopian tube. I'm not stupid. It's not ectopic. And they're like, well, but sometimes it's ectopic and it doesn't look ectopic. And I'm like, what? And then they said, oh, the baby's probably not going to grow normally because you're really underweight. And I'm like, isn't there a test you can do to see, like, growth hormone? And they're like, yeah, but, why do that? And I'm like, what? It was just, it was very insulting, honestly. I mean, because they would tell me, like, look, even if you can carry this baby to term, which is very unlikely, then, you won't be able to take care of your child with your mental health problems. I mean, you're going to end up losing your child, or, it's not going to work. And it's going to be too stressful for you. And I was like, yeah, I think that's my decision. And I don't think you're right. And I don't know why I felt so confident that things would get better, being pregnant and having my daughter, but it did. And I carried her to term. She was born completely healthy, not one problem. She's very healthy. She's smart, she's funny, she's wonderful. And am I a perfect mom? No, God no, but I don't think that exists anyways. Could I do better? Yeah, we all could. Do I still end up in the hospital sometimes? Yeah. Is that a problem for my daughter? Kind of. I mean, it worries her. But she also has her dad. He takes care of her if I'm in the hospital, which is very rare these days. Well, at least compared to what it used to be. It's more like 4 times a year instead of 20 times a year. Has she visited me in the hospital? Yes, since she was like a baby. I was breastfeeding her in the hospital. I refused to take meds because I'm breastfeeding. So, yeah, and I mean, I had postpartum depression, and that was extremely difficult. And then, if that wasn't bad enough, I was also sexually assaulted when my daughter was 1, which all of that together led to me needing ECT. It was like the only thing that helped to stop being suicidal. And I didn't want to kill myself because I wanted to stay around for my daughter. I love my daughter. I didn't want to hurt her, but I also didn't want to be without her. So I was like, oh, fine, I'll do ECT. I mean, whatever. I mean, the meds aren't working. And the ECT did work really well. Did I lose some of my memory? Yes, but I survived. So I'm grateful for that. And so is my daughter. And so is her dad. And yeah, I was married to her dad, but we divorced 4 years ago. And we're fine. You know, I have majority custody, which a lot of times people like psychiatrists are like, how can you have majority custody? And I'm like, well, I'm not always like this. You're just seeing me on the worst day of like the past 5 months or something. I'm usually quite functional, and I take really good care of my daughter. Actually, I am 100% committed to my daughter in every way, and the court decided that she's better off with me most of the time than with her dad, because I'm actually way more attentive and on top of everything she needs with school and everything. I do all the organizing for everything she needs. I'm like, it doesn't mean I have mental health issues and I sometimes end up in a hospital that I don't know how to take care of my daughter or myself or my friends, or that doesn't mean that at all. And I'm not walking around like a lunatic or something like that people think like on a daily basis. Like once in a while things get, for some reason, really too much for me, and I'm not quite sure what happens, but I end up in an ER, and then I end up in a psych ward sometimes for like a day, and then I'm like, I gotta go. I need to be with my daughter. Yeah, so I made a lot of progress with, you know, being able to recognize enough ahead of time when I'm kind of going downhill, so I can be more preventative and make sure my daughter's in a good place before things get too bad, if they were to get too bad, and like, you know, just ask your dad, can you take her for a little bit, because I'm not feeling so confident right now. And yeah, I see my therapist every week. I barely take any meds because I was force drugged for, well, nearly 2 decades on antipsychotics, and that resulted in a heart condition, acquired lung QT, which nearly killed me a couple times. So now I'm not allowed to take any antipsychotics. Yay! I hate those things. And yeah, so I've been doing a lot better since I barely take any medication. You know, I just take some things that help me sleep at night, because I have PTSD nightmares and stuff. But I mostly take, you know, things like melatonin. I mean, so I have realized the less psych meds I take, the better I've been able to function. But you know, everyone's different. Some people do really well with medication, but for me personally, that was how it turned out. Yeah. I don't really know what else to say, except that, I mean, I keep moving forward. Well, I've done a lot of different treatments that I didn't mention. So, I mean, I had ECT and I had meds, but I also did a lot of CBT and DBT. I also went out of state like 3 times to sort of longer term intensive inpatient programs specifically designed to treat certain things like PTSD, dissociation stuff, eating disorder stuff. So, and those involved a lot of different modalities, you know, like individual therapy, CBT, but also art therapy, drama therapy, music therapy. I also am really into music, so, but I don't really play that much anymore, but I used to. I used to do a lot of things. I don't do it anymore, but it's okay. But yeah, and I also got my certificate in the middle of all that craziness of being a yoga instructor, which I also don't do anymore, but I did. And I did a lot of meditation when I was doing that. And I mean, there's a lot of, I did volunteer work because that's also therapeutic. You know, it's not really usually considered as therapy, but it can be therapy for me. You know, so there's a lot of different things I've tried. I've also tried acupuncture and Chinese medicine, and I've been to naturopathic doctors, I've been to Western doctors. You know, right now I'm actually in the middle of having a full neuropsych evaluation done because seem to be new weird symptoms popping up. I'm not sure what to do about it. I've been in treatment with a neurologist because I also have seizures sometimes, and they're not quite sure what that is about. I also have, some brain damage that they see on MRIs. I'm not sure what it's from. But so I've seen a lot of different specialists and tried different therapeutic things in the form of, talk therapy, cognitive therapy, behavioral therapy, also medications, and, from Eastern to Western, yoga, meditation, music, a lot of things.
Yeah.
Respecting my boundaries, my limits, and recognizing them. That took a long time to figure out what they were. I'd always do more than was good for me. Just knowing when to sort of pull back and take some time to myself and just to let my mind rest a bit. Learning to delegate a little bit more, like when I'm overwhelmed. Basically, self-care for me is mostly about not allowing myself to get too overwhelmed and learning different ways of how to prevent that. And sleep is probably the most important thing, which I have chronic. Difficult time with, but I do everything I can to get a reasonable amount of sleep, because when I don't sleep for days, weeks, that's for sure going to get me into an ER and a psych ward. So I just have to stay very attentive to the signals that my mind and my body are sending me, and just stay in tune with myself, and also I'm still working on that, trying to accept, help from other people, support, which I always seem to feel guilty and embarrassed by, but
Someone needs their sleep too.
it's just like, I need some self-care. No, he doesn't need self-care, he needs your care. So it's mostly for me being aware of what I need and what's okay and what's too much, and figuring out how to balance things before things get out of control. Because once they get out of control, I don't have any, I have some control, but not enough apparently. So I really have to catch things earlier, and it's mostly prevention. A lot. I've had my freedom of choice taken away many, many times, and that always made things a lot worse. I was almost always, it was hardly ever my choice to go into a hospital. It was almost never my choice to take the drugs. It was certainly not my choice to be in restraints or in a seclusion room. But I have experience, because I was in Belgium, where that was a choice. Do I want to be in the hospital? Do I want to leave? Do I want to take this medication? I don't want to take it. And just being given a choice and feeling more in control because of that would automatically just make me feel stronger. And that opened more doors to, what other choices do I have? Like, what else can I try? Oh, if this is just a choice, I have my time to think of other things I could choose to do that might help. When people just impose a choice upon me, like their choice, and I don't have a say, I just get really angry and scared. And it just makes everything, all my symptoms worse. It just piles on top. It just becomes this vicious circle. They make choices for me, I rebel against it, or I'm terrified by it, and then they want to treat that in ways that I don't choose, and then I have some more problems with that, and it just goes on. Choices are very powerful. And it makes you realize that you have more control than you thought you did about, your own recovery and helping yourself. That's actually an option. Or trying to. Or choosing who helps you if you need help. And how. Not feeling helpless is very important. Yeah. Trust yourself. Follow your intuition. Don't just take the word of people who have power because they have MD after winning. Don't try not to doubt yourself too much. You probably know more than you think you do, and definitely more than they say you do. Be careful. Be careful. Not to scare anyone, but just think before you agree to anything. Think about it and be assertive. If somebody says you need to do this or that, ask questions. Why? How's that going to help? What are the side effects? What is that going to do to my personal life? What is that going to do to my professional life? What's that going to do to my family? Ask a lot of questions, do a lot of research, but be careful where you get your information from. There's a lot of wrong information out there. I would just say keep yourself informed, ask a lot of questions, talk to a lot of people, talk to peers who've been through it, ask their opinions. Maybe they have some advice, you don't have to take it, but I think the more ideas you can take into account, the better. The more information you have that's real lived experience from other people is very helpful, because they can tell you what actually happens, not what they say is going to happen, because that's often not how it goes. They say one thing, but that's not really how it is. They say, we're just going to help you, but it doesn't feel like help. And it's not really helping. So, I would say just keep an open mind to listening to a lot of different people and asking a lot of questions, and don't forget to trust yourself.
At the end of it.